Good evening, everyone. I'm Leo Dulyanet Menu.
And I'm Leo Casey.
We will be your host for today's webinar, and now I would like to invite Leo Hansali Rajasinghe for the opening speech.
Once Bob Marley said that you never know how strong you are until being strong is the only choice you have. Good evening, everyone. I would like to welcome all of you Pretty Petals PCOS Awareness webinar on behalf of Leo Club of Godigamuwa, Sri Lanka, Leo District 306A2 and Leo SMK Subang Utama, Malaysia, Leo District 308B2. Sometimes you may wonder what's this PCOS. First of all, let me tell you what that means. Basically, it's the polycystic ovary syndrome, commonly we called as PCOS. This is a common hormonal disorder among women and a condition where ovaries produce an abnormal amount of male hormones. Do you ever knew PCOS is unfortunately reported to occur in 1 of 10 women nowadays, and this is proven by numeric figures. However, most people are ashamed to talk about this. But it's time to think out of the box and be aware of this. How many people are struggling with this problem? And as a support for them, as Leos, we decide to conduct a PCOS awareness program. Most importantly, this program is not only limited to ladies. Therefore, I would like to invite everyone to stay connected with us until the end of the program. Dear gentlemen, this will be real help for your mom, sister, girlfriends, and your wife as they may struggle alone for this. If we can make a smile on someone's face, how wonderful we could be. So please stay connected and be aware of this common hormonal disorder. Let's be a strength for the others. We are glad that Dr. Suranga Hettipathirana from Sri Lanka and Dr. Lam Vikyan from Malaysia have joined us today and warmly welcome to talk about PCOS in depth. We'll be conducting a Q&A session during the program, therefore stay connected. Without taking more time, let's begin our program. Pretty Petals by remembering the golden rule. Precaution is better than cure. Thank you. Over to you, Cassie.
Thank you, Hansali. So today, this discussion is going to be about PCOS, also known as Polycystic Ovarian Syndrome. I'm not sure whether you're familiar with this syndrome at this point, and we also posted some infographics and guidebooks on both of our club's Instagram. But this is one of the most common problems young girls, as well as women of reproductive age, deal with. Gender doesn't matter in this situation. If you're a male, you can still learn things about like this, and maybe look out for your loved ones too. I believe some of you have thousands of questions right now, so do I. So without any further delay, let's move into the panel discussion.
Today we have Dr. Lam Vikyan, MBBS, MMAD. Dr. Lam Vikyan is an IVF specialist working at Alpha Fertility Center in Malaysia. He's a consultant, obstetrician and gynecologist who has been a qualified specialist in this field since 2016. And next we have Dr. Pradeep Suranga Hettipathirana, MBBS, MD, MRCOG. He's a consultant, obstetrician and gynecologist. Now he's working at Dr. Neville Fernando Teaching Hospital. Also, he is an IVF specialist in Dr. Navaloka Hospital, Colombo. To start this discussion, Dr. Suranga, can we have an introduction and biological process of PCOS?
Yeah. So thank you all for inviting us for this program. And actually, it's very good initiative where we elaborate and we teach others on what is this polycystic ovarian syndrome, because it is quite a common condition that's not only in certain like countries like Sri Lanka or Malaysia, but all around the world. Okay, so if we take polycystic ovarian syndrome, as Hansali said, like, okay, we do say that it affects 1 out of 10 women. So this data actually is for the UK, but if we take the countries like Asian and South Asian countries, they do think that it is even more than that. So from the studies like, or the research they have done in Sri Lanka, they do think that it is around 1 in 6. So it is fairly common. So it's fairly common. That is what is important, because what we do see, I think in our further, like when we are moving forward with our discussion, like we are discussing on those aspects as well, fair number of people, they are quite concerned because of this disease, thinking that this is a very bad disease and it is like going to ruin all of their future life. So these girls are coming in very desperate or in very psychologically disturbed way. But what you have to identify is, like, it's quite common. It's a very common condition. Most of them, they don't come up with the symptoms and the problems which we are going to discuss in further, but most of them they do have. So what you have to understand, so normally we call this one as polycystic ovarian syndrome. So which syndrome, like in medical terms, which means that it is a collection of so many problems. Like it is not just a one disease. So there are a collection of so many symptoms, like it involves so many organs. So basically, if we do take in polycystic ovarian syndrome, mainly they do involve with the like regularity of the periods, but it do involve with the problems in the skin. So there can be problems in the skin. Like, so there will be like you would like we would be elaborating and we would be showing you in later. So they would involve with the like there can be manifestation of the skin, and as I said earlier, there can be periods in this problem we will be discussing further, and there will be psychological problems. And if you take further, like this disease process, this affects the whole reproductive span of life, and even afterwards there can be effects. So they can have disease in future. So likewise, there are so many like implication and so many problems because of this condition. And the next thing I want to, like when I'm elaborating on this polycystic ovarian syndrome, like with this nomenclature, there is a problem. Like it says that cyst. Like obviously when someone says that there are cysts, they think that it is something bad, because when someone say that it is cyst, it comes to your mind, okay, this might be a cancer. But what you have to identify, these are actually not cysts. These are not pathological or cysts which cause problem. So for like now, like actually what do happen in this polycystic ovarian syndrome, one main problem is they are, like, you know, in females every month there is ovulation. That means they do have eggs, they do mature every month, and they do ovulate. So what happens in people in having this problem, these follicles are not maturing, so they are not ovulating. So that is one basic pathology in this disease. So they are not cysts. Actually, they are immature eggs or the follicles. So they are immature eggs. So no need to worry thinking that you are having some cyst, which is a very bad thing. Okay. So basically, like on bottom line, what do happen is, due to many factors, there are so many hormonal imbalances happening in your body, in the female, like in their system. So they can't, like, so there will be excess in some hormones, and there are some hormones are less. So there would be so many problems, like as we said, that there will be problems in their periods, the regularity, and they would like getting facial hair, like we will be discussing in further when we go down. So basically what will happen, there is a hormonal imbalances happening in their system because of so many factors. Okay. And what we have to understand is, this is going to, like in the I'm discussing in, like when we further discuss the how it occurs and what are the other ways, like what are the problems and these things. So this condition it's going to affect the whole reproductive period. Like in some, like even before they are like, so normally the most of the symptoms manifest when you are after what you call menarche, after starting your periods at that age. But in some, it can happen even before. And these symptoms like come and go like during the reproductive age, and in some of the manifestation of this disease can go further beyond, and even to like after late 50s also, some of the problems of disease can manifest. So we will discuss them further in detail, but to give an overview, like this polycystic ovarian syndrome, this is what basically it's a very common, which is there in the society, which having so many symptoms, symptoms affecting these females. Yes. Yeah, Julia, we can move forward. Yeah.
Okay, so next I have a question for Dr. Lam. What are the symptoms of this and how can we identify them by ourselves?
Thank you for your kind introduction and inviting me to give this sharing. Okay, as Dr. Suranga said, the symptoms of PCOS varies from individual to individual. If you doesn't manifest this kind of symptoms, doesn't mean that you are free of PCOS. That's why you need to come and see doctor, to consult doctor to identify whether you have this PCOS or not. PCOS is come from the polycystic ovarian syndrome. Because it's a syndrome, that's why the manifestations varies. So it's related to the underlying pathophysiology. Mainly is due to abnormal hormone or imbalance. The female hormone is lesser with the exceeding of the male hormone. Specifically, is a testosterone hormones, and it will also associate with the metabolic syndrome. Next. This diagram is show there's a woman presented with the symptoms of PCOS. You can see the graph, the picture there. It shows some hair loss, hirsutism. Hirsutism meaning that is an abnormal hair growth in a woman, meaning that the woman can have some abnormal hair growth over the upper lips, or the chin area, the upper chest, and some limbs area. We call it hirsutism in the medical terms. Patient also can have some abnormal pelvic pain, tends to have obese or overweight, some excess in the androgen level, manifests as excessive acne, hormone imbalance causes have irregular periods. Subsequently, because due to the hormone imbalance and difficulty to ovulate, the patient could have suffered from the infertility. In my clinic, those women come to see me. Usually, they didn't come with PCOS symptoms. They come to me with fertility problems. After checking, after assessment, then we find out, oh, because you have this PCOS problem, you're unable to ovulate regularly. That's why you suffer from infertility. That's why the symptoms differ from individual to individual. Next slide. Yeah. I think the Dr. Suranga will elaborate this one, how to recognize PCOS.
Dr. Suranga, how can we recognize this syndrome? What are the diagnosed methods?
Okay, yeah. So when we are discussing how we are going to recognize PCOS, like what we have to understand is, like normally in a healthy female, they do get period every month. So like when we do say regular cycles, normally a female should get like their periods, like it's not going to be like, though we do say that every 28 or 30 days a female should menstruate, it doesn't apply to all. So it varies with few days. But the maximum duration between periods can be up to 35 days. So in a female, in a like who has gone into menarche, if they are not getting their periods every 35 days, where their periods go beyond 35, which means like every other month, or sometimes even every 3 monthly or every 6 monthly, okay, that means there's some problem. So if you can remember in my first slide, what I do say, one basic problem in this polycystic ovarian syndrome is they don't ovulate. The ovulation process has disturbed because of these hormonal effects. So because of not ovulating, they won't get periods every month. So their periods can go beyond, like interval between a period. For a interval between one period and start of the next period, it can be, if it is more than 35 days, okay, you should be alarmed. Like you should be alarmed. Okay, now it is not happening. So if it is keeps on happening, like if you do see like when you do see like if it just happened once, like, oh, no need to worry, because like this ovulation, like there are so many other factors affecting ovulation. So depending on the other life events, like randomly it can change, randomly it can happen. But if it keeps on happening for months and months and years, okay, then there's some problem. So one thing what we have to be aware and you have to keep it note on is the interval between your periods. Then the next one is what I think in the previous slide, like in the image, Dr. Lam has explained that there would be like excess of testosterone. That's the male hormone. So if we do take, like, no need to worry, like all the females, they do have like male hormones. The same way the males are, we are having some amount of female hormones. So having the male hormone is not the problem, but there is a level that they do should have it. So in the females also, they do have male hormone, but at a lower level. But in the females who are having this polycystic ovarian syndrome, what do happen is the level of this male hormone testosterone is little bit above the normal for a female. So because of that, actually the male hormone is the one which drives and which cause, like gets like the reason why the females do get, like even males get these pimples or acne and this body hair. And as Dr. Lam said, that body hair, like facial hair, normally we say that upper lip, the chin area, sometimes like they do get in the chest and on the back of the, like, and in the tummy, like below the belly button, if there's hair, like those are the features to say that, okay, like you have to be alarmed because this is due to excessive like the male hormone. And the other one is loss of hair, mainly on the front of the, in the front part of the head, like they do feel that they are losing hair. So these are some of the like features of excessive male hormones. So in this female, so if they do have these ones, okay, you have to think, okay, whether this could be due to polycystic. And the third feature I will skip because that's a test which we had to do. Then only we realized that it is like that's after ultrasound scan. The other things that you have to think about is that they do have oily skins. Like it is like if you do say that skins are like, normally we know that we do say that we do have dry skin, we have normal skin, and then we have oily skin. So their skins are very oily. Okay. Then the other things are like it, like I think there's a diagram in the next slide. I'll show it to you. That skin creases, mainly the neck, your underarms, like those skin creases, the flexures, like on your elbow joints, these ones get darker, like blackish, like crease, like the skin creases, they would get dark. So normally in the medical term, we call it acanthosis. Like, so this is some other thing. And in okay, like, so we are moving to the next slide. In this one, on the like one towards your right side, like in that lady, the neck, that skin, that it has got dark in color. And if you do see, and the middle one, it shows that facial hair, like in the lower, chin, in the chin area, they do have, because normally in females they don't get, they do have some, but not to this extent. And in the first one in the left, they show that the front, we call frontal baldness, they do lose hair. So those are the features. And the last one in my previous slide, what are the says, like some females, they do secrete milk from their breast. So when they squeeze, if they squeeze, or in some females, and some, they do have some small amount of milk is coming out of their breast. So these are some of the features they do get, like if you do get, because there are so many other reasons for these symptoms. For example, if you get breast milk secretion, that might be a problem because of your thyroid or because of a hormone, another hormone called prolactin. But still, if you do get all these, like no need to be all, few of these, like your periods are irregular, on top of that you are having irregular periods, you are getting a lot of pimples, And so like, and your skin creases are getting darker. Okay, then you have to think, okay, like this might be polycystic. Okay, so where then you have to go and seek medical advice, and where you have to go and see a doctor, basically a gynecologist. Then we do certain tests, not necessarily, because like I'm not going into detail on the how do we diagnose even polycystic. We can diagnose clinically. There's no need to do tests, but we can do tests to confirm our diagnosis. So one is ultrasound scan. So if we do ultrasound scan, we can see the eggs are not maturing. In my first slide, I said that this problem is because they don't ovulate. So when we do a scan, we can see small tiny ones. They are less than 1 centimeter. The follicles are not maturing, so we can see a lot of immature follicles around the ovary. So in both ovaries, not necessarily in both ovaries. So in one ovary we can see. So that is one. So that is what, even though we call polycystic. So because poly is now lot of cystic means all small cysts, but actually they are not cysts, they are immature follicles. So we can see that one. And then to further clarify, like we say that their male hormone level or the testosterone levels are high, so we can check their testosterone level. So then we can see that it is above the normal. Then so by doing these ones, okay, we can come to the diagnosis, okay, whether this female is having polycystic ovarian syndrome or not. And in addition, there are some other further tests which we are doing, which is not necessary, and no need to like go into the, like no need to do it in everyone, like because depending on their how severe it is and their body habitus, like we do it like serum insulin level, like the blood insulin levels and so forth. But basically, like apart from that, what I have said, so if your periods are getting more than 35 days, you are getting a lot of body hair and acne, pimples, and if there's losing of hair, and if these things are there, okay, it's worthwhile going and meeting up a doctor, because we will discuss in further when we are discussing about this disease and how it occurs and what to do and what not to do. It is important to diagnose early, because there then we can do a lot of lifestyle changes to control this disease. Okay. Yes.
Thank you, Dr. Suranga. Now, next question. How does PCOS affect the day-to-day life of a person, both physically and mentally? And what are the complications that can affect it? Like, are there any health issues linked to PCOS?
All right, next slide. Okay, as we mentioned before, the PCOS is presented with the menstrual problems. So if your concern is due to the menstrual problem, because you have a irregular period, usually the woman 3 to 4 months doesn't have any period. Some very classical PCOS cases, it can up to 6 months to 1 year, the woman don't have any period because of the very severe hormone imbalance. So for that patient, if you doesn't have regular periods, number one, it's not good. No period until more than 4 months is not good, because the lining of your womb, we call it endometrium, it doesn't shape. Usually, naturally, every month, the lining of the womb will shape every month. Then we generate a new tissue, we build up. In PCOS patient, the lining will keep over there for months. Then, if the lining kept for too long, it will tend to have a mutation, some changes, we call it hyperplasia, abnormal change of the lining. So it's not good. So we usually advise for the PCO patients, which doesn't have a regular period, to have their menses to induce every 4 months. If you don't have any menses more than 4 months, we recommend and advise to take some medication to make a period to come. Okay. Second things, for the menstrual problem, like Dr. Suranga mentioned, the lack of ovulation, meaning that the woman don't have eggs to produce and mature. In other words, it's not fertile. If you got no eggs to produce, if you are keen to conceive, then it's very difficult to conceive. Next is the infrequent bleeding because of the, again, is the hormone imbalance, the female hormone very low, testosterone hormone very excessive, then it causes infrequent bleeding, meaning that between the period cycle, it tends to have irregular menses. Next.
Thank you, Dr. Lam.
The other is due to the, besides the menses problem, is due to the physical change. As mentioned before, the patient tends to have hirsutism and normal hair growth, acne, a lot of acne, then oily skin, then that will all contribute to the self-esteem of the woman to be low because they will feel more inferior because of the physical changes. They have a body image less attractive, and as well as we can affect the psychosocial as well. So these physical changes will make the woman to have an increased risk of depression and as well as anxiety disease disorder. Is in overseas got a few study being carried out. They said PCOS woman that tends to have increased prevalence of the depression and the anxiety disorder. Next. The other is metabolic syndrome. If you have PCOS, because of the, again, it's due to a hormone imbalance, it tends to have insulin resistance. Insulin resistance is manifest by the some skin changes, like Dr. Suranga mentioned. There's we call acanthosis nigrans. There's a thickening and discoloration of the skin creases at the back of the neck, some fractures and the creases of the body. That indicates the woman has a insulin resistance. If you have an insulin resistance, you tend to have a diabetes mellitus later on in life. Next, if you have abdominal obesity, difficult of losing weight, craving for sugar, chronic fatigue. One of my patients, they say that, doctor, I have this metabolic syndrome as a doctor diagnosed. The patient has a very difficult to control her weight. They say, I do a lot of exercise, modify her diet very straight, but still very difficult to bring down her weight. This mainly due to the metabolic syndrome. Maybe that woman require other option, the other option treatment in order to help her to reduce the weight because of the metabolic syndrome. Next. I mentioned this repetitive, the overweight and obese. Most of the PCO women, they will be overweight or obese. More than 50% be presented of overweight and obese. But bear in mind, if you are already thin, doesn't mean that you doesn't have a PCO. As we mentioned before, how to recognize the PCO, the overweight is not one of the criteria, but usually PCO is associated with obese and overweight. Next. Lastly is an infertility problem. Because you doesn't ovulate regularly, then most of my couple to come to my clinic, they will come with the chief complaint of difficult to conceive. After investigation, then you know, the wife have a PCO, difficult to ovulate. Regardless, you have a sexual intercourse 10 times a week or what, because you can't ovulate. So you can't ovulate, meaning that the chances to get pregnant is very low. That's why the infertility problem is the main concern, especially for the PCOS women, because they usually take longer to get pregnant because of ovulation, hormone imbalance, irregular of the periods, then difficult to ovulate. Next. The lifetime risk for the PCOS women, they have an increased risk of the diabetes mellitus 50% more compared to the general population, as I mentioned, due to the metabolic syndrome, as well as the risk of endometrial hyperplasia as I mentioned, because of we call amenorrhea or irregular menses, because of the lining of the womb start to change and mutated, become thickened, then the increased risk of the endometrial cancer is threefold higher compared to the normal population. Yeah.
Dr. Suranga, what are the main causes of PCOS? Do they depend on the food we consume or daily habits?
Yes. Yeah, we'll go to the next slide, please. Yeah. Okay. So basically, if we take the etiology or why you are getting PCOS, so the exact reason no one knows. So the what we know is unknown. Like for example, now if we know like some disease, we know that this disease is caused by this way, by an infection or by some, like if you take diabetes, it is because the insulin is not produced enough. So it is like that. But when it comes to PCOS, they don't have a to exact reason. So why this is occurring? So the etiology is unknown. So there are so many theories. Like they do say because of this reason it is coming. Because like if you take the symptoms, like as Dr. Lam and I in some views, I also have shown you that there are so many symptoms they do get affecting from the skin, like hormone system, the fertility. Likewise, it affects so many things. And late in the life also there are things. Okay, so they don't. So they don't know the exact etiology. But what they have seen is there's a familial tendency. So like polycystic ovarian syndrome, when they do have, they are like, if you do see like your sister might be having, or your mother might be has had it, or the mother's sister might has had it. Not necessarily maternal side. So if you take your father's side from the paternal side, okay, your father's sister might has had the same problem, or like they do have periods are not irregular, they do have a lot of like body hair. So it might be so because they think that there is some genetic component affecting this disease, like from genes, like from your parents you inherit it. So, not all every time. So they so some say 20%, 40%, like it's percentage wise it varies, like, but they do say that there is some genetic component or genetic involvement, genes, your genes they are carrying. So you get it either from your mother's side or you're from father's side. In addition to that, there are so many other factors, so which they don't know. Like they do say that one problem is because the you know that insulin is the hormone that is necessary for our blood sugar control in the body. So they have noticed that there is some problem in the sensitivity of the insulin receptors to insulin. So in them that their insulin levels are high. So they do that as the insulin is not working properly, the possibility of getting diabetes is high. So likewise, there are like Dr. Lam also said about 50% of time they would get it. So because of that, there are so many other changes happening because the insulin is not working properly. So because of that, it increases the body testosterone level, which we discussed earlier, which is the cause for that's the male hormone. That's why they are getting this pimples or the body hair. And loss of hair, everything comes because of this testosterone. So leading to this abnormal other hormone levels. So like when it comes to the exact cause of the polycystic ovarian syndrome, no, like exact reason, so we don't know, but we know that it is plain like a lot of things coming into for the causing this problem. So one is genetic, so like you inherit. So when we talk about this one, the important point is what you have to identify is, because we have seen a lot of people do come, like I do come and saying that I'm having this problem, like, so can you cure for it for me? But so we know that if we do inherit something from genes, you can't inherit. So what you know, the important point in polycystic ovarian disease is be aware that you are having this condition. And then comes the control of the disease. Okay, so you can't cure this one because like if it is genetically inherited, you can't cure, like, so you have to control. Like in Dr. Lam's also in slide, he has shown that obesity is a main problem in this one. So in obese people, the signs and the symptoms which we have discussed earlier is more. The more you get obese, the symptoms would be more, like the facial hair or the acne or the, because in this when you're obese, your fat content in your body is more. So invariably the possibility of getting high androgen or the male hormone levels is also more. So your symptoms, the periods irregularity would be more. So the symptoms are more in obese people. So in one part of the question, what you have said, like whether it would, the cause for this disease, whether it would affect the way we are eating and the food habits and things. Yes, it plays a part, but it is not the key thing, because we have seen fair number of around 40% of polycystic patients, they are quite lean. They are not obese, but they do have this one. So obesity, like, so the eating is not necessarily going to cause it, but it can make this worse. So what I'm saying, like, because we don't know the exact cause. So if you do have this one, control is one thing. So the control, one key thing is reduction in body weight if you're obese. So you should know how to know that you are obese. There is something called BMI. If you Google it, you know how to calculate your BMI. You do with your height and weight. So you know whether you are in the your average or good BMI range. If you are not in that one, if you are in obese range, okay, you have to work for it. So the basically, when it comes to management, like I think Dr. Lam is discussing in like later, one key thing is, like, for the success of the treatment is, one, if they are obese, is to reduce on the weight. So the reduction in the weight is very important. So what you do eat, yes, it plays a part. So the people who are having like a polycystic ovarian syndrome, and like if you have diagnosed and if your doctor said, okay, you are having this one, okay, don't go on doctor shopping, like, because that is what we do see. Like one doctor said, okay, you are having it, then they, okay, forget about it, they go to another doctor, and they go to another doctor. And in, I don't know in Malaysia, but in Sri Lankan setup, then they go to some other alternative, like what you call this Ayurvedic medicine, Ayurvedic. So they are thinking like to seek for a treatment for cure, like it's like so rather than cure, the main thing is control. So food plays a part. So if you're obese, cut down on your sugary stuff, fat, very important, and then on exercises, because if you reduce weight, like they have seen, like if you reduce your weight itself, that it will revert back a lot of these symptoms which we have discussed before. For example, suffer like infertile, like if you are not ovulating, then they would come back, they would start ovulating. So yes, food plays a part. The way you are, yeah, the habits of, like, so even though they know, they don't say, like, if you put it other way around, I am not saying all the obese people, they do have polycystic ovarian syndrome. So it is not. So polycystic ovarian syndrome, they do have a lot of inputs to get this disease, but obesity can make it worse. So yes, so you have to keep an eye on what you do eat, and your other habits, exercises, very important. Yes. Yes, Dulya, we can.
Thank you, Dr. Sranga, for that. Now, here's a question for Dr. Lam. In order to overcome this situation, like, what are the steps that we can follow? Are there any medical or non-medical treatments?
All right. For the management of polycystic ovarian syndrome is very complex now. You need to have strategies how to manage it. Divide into the medical and non-medical approach. As Dr. Lanka mentioned, we need to reduce weight. If a patient is very obese, by reducing the weight, ideal BMI, meaning that, if the woman is obese, by reducing weight about 10%, surprisingly, we can make the hormone imbalance getting better, and menses regularity will be improving, and as well as the fertility properties will improve. Okay, this will take some very much time, effort, and commitment, because to reducing weight, because it's associated with the metabolic syndrome. It's sometimes not blaming the woman not reducing weight because of the metabolic syndrome. It's very hard and difficult for her to reduce her weight. So it must go hand in hand with diet, exercise, together with a self-discipline, to control the weight management. Next. The medical approach, if your concern is based on the menses issue, if a girl come to my clinic, they complain of the hormone imbalance with irregular menses. So we will give some medication, the hormone pills, in order to regulate her menses. If a couple come to my clinic with a chief complaint of difficult to conceive as a consequences of PCOS, we do have some fertility treatment for the PCOS couple. We can prescribe some ovulation pills to make the woman to ovulate, to produce the eggs to mature, to ovulate, or we can give some injection, the stimulating hormones injection to make the woman to ovulate. Of course, it's injections is involving the IVF treatment as well. If a woman with a chief complaint of the weight management very difficult with a metabolic syndrome issue, we will prescribe her with metformin in order to improve her insulin sensitivity. Of course, this one is based on the patient, the outlook of the patient and the profile of the patient. See what's the chief complaint of a woman wants us to help. If a menses problem, we regulate her menses. If a fertility issue, we make her to ovulate. If a metabolic syndrome, we give some medical treatments. Okay. The other approach is a surgical approach. I think most of you will heard about the laparoscopic ovarian drilling. As I mentioned before, PCOS, because the follicles is difficult to mature, to grow because of the anatomical structure of the ovaries with a thickened wall. So all the retained follicles remain in the baby size, less than centimeter. So by doing the ovarian draining is a surgical procedure. The patient need to get herself to be sedated, general anesthesia. We put a keyhole approach with is one of the operation we call a keyhole surgery. Then we use one of the special gadget we call to laser and to titanize the ovaries, meaning that to rupture the cyst. Because it's a polycystic, we rupture the cyst so that we can rectify the hormone imbalance. After the surgery, 50% of the woman can regain, can make her menses regular, can improve her fertility property. But unfortunately, however, got 50% doesn't show any improvement. But this is that's why the laparoscopic ovarian draining is only tailored and specified to certain women. It's not recommended for everyone. So let the doctor to decide whether you are suitable to undergo this surgical approach or not. Next. And then this last slide for the management of the PCO.
Okay, Dr. Stranga, I would like to ask, how do we raise the awareness in the society about PCOS and build a positive idea among them to face PCOS?
Okay, yeah, so it is very important about the awareness. Why I am saying so, like if you have gone through what Dr. Lam has said, in some, not in all, like females, like in some females who are having PCOS, they can end up with getting cancers in your womb, that is endometrial cancer, number one. Number two, they can get diabetes. Okay, so if we take now, why, like if I do explain, like just take one, like the reason why they are getting this cancer in the womb is because they are not shedding their inner lining of the womb quite regularly. So it is important that a female should shed their inner lining of the womb in a regular fashion, not necessarily every monthly, at least every 2 monthly or every 3 monthly, like otherwise it is not good. So what we do have seen in our clinical practice is sometimes like we do females, they are not like quite like educated on about this what is, and so if they, even if they don't get their periods because they are not married, they are not sexually active, so they are not worried about like whether you are pregnant or not, so they don't like, because like to be truthful, like if you put it in other way, like if you're not getting periods, in a way it's a very comfortable for a female, like because period itself can cause some, like it is very like there can be like a pain and everything because of that. So some of them, they don't, they forget about it and they just wait, but they do have a lot of clinical implication or the problems that can happen in the future. And next thing with the diabetes, the same thing, like so they can, so this awareness, social awareness is very important. Okay, so actually like your initiative on this conducting this webinar is very important, like very good. And likewise there should be awareness. So what we have to put into the people, like the females who are having, like what we have to make them, okay, number one, if you are having these symptoms, okay, go and seek medical advice and see, and if you do having this one, admit it, like no need to worry, like this is not a very bad disease, like this is not going to make you to die, you're like, no, this is just a run disease which is a hormonal imbalance. So if you do some interventions, there would be a good outcome. Okay, so like as I said earlier, like if you're obese, if you are like, and because like we see that, because if you're obese, if you cut down on what you are eating and if you do good exercises, if you reduce your weight, okay, the risk of getting diabetes would be come down to a certain extent. I'm not saying that you're not, but it is like so. So what is important in polycystic ovarian syndrome is to identify, number one is that you're having this one. Okay, if you're having this one, don't worry, and then don't like think, okay, that there is the end of the life. This is some just a hormonal problem. And if you do, there are so many interventions. Like I think in the intervention, Dr. Lam has explained that in the intervention, there are so many things to do. If you are having body hair, there are some interventions we can do. If you are having like for fertility, there are interventions we can do. So what basically what we do, as I said earlier, like for the polycystic ovarian syndrome, there is no cure saying that if you do this one, it will get cured. Okay, you will be free of all these symptoms and signs. So no need to worry. No, there is nothing like that. So it is, we have to see what the female is having and we have to address that problem. So if they are not getting pregnant, okay, we have to make them to ovulate. So there are enough medication. And if they are having body hair or like losing hair, okay, there are medications which we can give to address that issue. And if they are not getting periods in a regular fashion, I say that it is very important in a female at least to bleed every month, every other month. Okay, then we can give medication. There are hormone medication and there are so many other medications which we can give and which we address. So that what is important is knowing about this disease. And okay, if you are knowing it, don't try to deny it. Okay, no, I don't have this one. Okay, if you're having a disease, you have to accept it. Like for a simple example, what I am saying, okay, my skin color is not fair, so we have to admit that one. Like there's no point like then going and getting us thinking, okay, now this are not fair, like I had to do something or whatever. Like no, you have to admit and you have to move forward. That is life. So if you do have polycystic, main thing is, okay, you can, like if you Google that, there are enough articles and like sites where you can get education, what is this and what to do, what not to do. So, and then do whatever the interventions which we have discussed in the past, more or less in the 1 hour, do these interventions, then you can control the disease and like it would be something as normal. So no need to worry. So the key thing is education and then good life, like lifestyle changes, this food and exercises. Most of these things you can control and you can move forward. Yes.
What about Dr. Lam? What do you have any opinions on social awareness about PCOS?
Yeah, I totally agree with what Dr. Suranga has mentioned just now. Very comprehensive explanation. So I just want a point to add on. Yes, PCOS is not curable, but we can manage to reduce the complication and the symptoms of it. As I mentioned before, awareness is important. Like you are having to educate the more reproductive age group of the woman to know their body. Some of them, they're very shy. They know they have a menses problem, but they're really shy to confront, to see a doctor, to consult a doctor. I think there's social awareness regarding this PCOS is very important. I appreciate your organizing team committee to have this webinar to carry on to create the awareness of this PCOS.
Thank you, doctors. Now it's time for the Q&A session. If you have any questions or problem regarding PCOS, you may unmute your mics and ask now, or you can send it via chat forum.
Hello, can you hear me?
Yes, we can hear you.
Okay. Doctor, can you explain a little more about how does PCOS affect pregnancy? Can someone still get pregnant if she has PCOS?
Yes, like if you take PCOS, no need to worry. I think Dr. Lam said that there are so many interventions which we can do. So the key thing is that they are not ovulating. That's why they are finding it like difficult to get pregnant, or like it takes some time for them to get pregnant. That doesn't mean that they won't get pregnant naturally. They can, because they would ovulate in some months they are ovulating, in some months they are not ovulating. So naturally also they can get pregnant, but if not, there are so many interventions. There are so many medications which we can give to make their follicle, like the eggs to mature. Or else, if it is not working, I think Dr. Lam mentioned that we can do a procedure by the name laparoscopic drilling, like you make some holes. Like in that process also, we can make them to ovulate. So you can get pregnant. Okay, fine. So there's no need to worry saying thing like, but it might take some time. That is the issue. Okay. The next part of your question is, okay, like during pregnancy, what are the problems and whether there would be implication? Yes, there can be. So what we have found that in polycystic patients, the possibility of getting miscarriage is bit higher. And we said that there is some problem in the insulin sensitivity or the action of the insulin on the body. So the chance of them getting diabetes is higher. So that is why it is important, right, when you are like from your younger days, like if a female, like even when they are like at menarche or soon after menarche or after some time, if you do think that your daughter or your sister is having this one, to identify this problem and to control from that point of view. Like if I put it this way, like if a polycystic patient who is obese, if they can come to a normal BMI before getting pregnant, okay, fine, the outcome would be much better compared to an obese patient, like polycystic patient who is very obese getting pregnant. The complication would be like more. So like there can be implication, but there are so many interventions. The medicine is quite developed, so no need to worry. Don't think that you won't get pregnant and you will never get pregnant. No, that won't happen. You will get pregnant. There are so many interventions. The medicine is important, developed. But what matters in polycystic is there is a big part that individual patients or individual persons where they have to have some commitment with regard to control of this disease. Because key thing is control, because if you do think, the outcomes would be much better. So that don't worry, pregnancy is not an issue. They can get pregnant. There are so many interventions, number one. And during pregnancy also, like there are so many things we can do, control, like exercises, diet and these things. So there are risks, but there is no reason why you should get worried on getting pregnant or worried on whether you are not going to get pregnant. Don't worry. Like we are seeing, because I said in Sri Lanka, it is 1 in 6. It's a big it's a big portion. Like when you're walking on the road, if you count 6 females, okay, one of them is having polycystic. That doesn't mean so that all of them are going to end up with some problem in getting pregnant. No, so don't worry, be aware and put some effort on control of this disease. Yes.
Okay, thank you, doctor.
Doctor, are there different types of PCOS, or is it just one type?
Dr. Lam, that's questions over to you.
Pardon, I can't. Can you repeat the question? I can't hear the first statement.
Are there different types of PCOS?
Okay. Thank you, Tanya. Okay, there's no different type. Usually we classify as PCOS as a mild or severe type because the symptoms varies. So there's no quantitative or qualitative strategies to quantify which type of the PCO. We only put whether your symptom is mild or very severe type. Of course, this depends on your presentation and what your concerns. Yeah.
Okay, thank you, doctor.
Doctor, can you explain me the role of weight in PCOS?
Sorry, role of?
Weight in PCOS?
Yeah, wait, I think I mentioned before, the part is like if you, what, you know what is a BMI? Okay, BMI is something which we calculate taking your height and weight into consideration. Okay, so if you Google, you can see how to calculate your BMI. It's something simple. You can measure your weight, your height, and there's an equation. If you put that, it says, okay, this is your weight is normal, or it is more, or it is less, like it's very underweight or overweight. So the weight is, if you're obese, now if you're having, I said, if you're having polycystic ovarian syndrome, and if you are obese, the problems or the symptoms would be more. Like, if you can bring down your weight down and come to a normal BMI, that doesn't mean that you will be get cured of from PCOS. No, but your symptoms would be come down. Like if you, like if there's a problem, like they don't ovulate, because of that they are not getting periods regularly. If you bring down your weight to the normal, okay, you might start ovulating and you might get regular periods. So the weight has an effect to make the disease worse or better, but it is not going to cure it. So don't take like going to say, okay, if you cut down on your weight and become less weight, that you are going to get cured. No, it is not, but it is going to make your symptoms better. So as I said earlier, so be watchful on what you do eat. You should not eat much. You have to cut down very much on your sugar and the starchy things and fat. Sugar is very bad because obviously we say that there is more tendency to get diabetes. So because of that, you have to be watchful on that, and then do good exercises to bring down the weight. Okay.
Thank you, doctor. Are there any more questions? No, we'll move on. Thank you, doctors.
Thank you, Dr. Suranga Hettipathirana and Dr. Lambe Kyan for taking out time from their busy schedule and enlightening with knowledge. This webinar gave deep insights into the topic and also revealed many informative facts. Now it's time to present our photo challenge concept. A big shout out to who participated in this challenge and spread our PCOS awareness program.
Thank you to doctors again. And also a big thank you to everyone for joining us this evening and to all Lions, Leos, and non-Leos who supported us to make this project a success. We hope you learned something in this webinar.